Hey, Cottonwood Creek, welcome back to another podcast episode. Today's podcast is really one that kind of hits us where we all are as we move into the Thanksgiving season and the Christmas season. And at the same time, we look forward to being with family and friends around the Thanksgiving table and then ultimately Christmas and all those other things. At the same time, you look at the media and we are seeing spikes and hearing about spikes in COVID and the coronavirus. And so we really wanted to sit down. I really wanted to sit down with Joe Minissale. He is the president of Methodist McKinney Hospital right here, as well as a member with us here at Cottonwood Creek. How long have you been at the church, Joe?
Since 2006.
All right. Now, how long have you been the president there at Methodist McKinney Hospital?
Since 2010.
There you go. And how are things at the hospital right now?
Things are well at the hospital. We are very blessed.
Yeah.
As you probably know, since we really just do elective surgery,
Yeah.
COVID hasn't had a major impact. Of course, things are a little slower, but we're doing well.
Yeah, good. And Joe and I have talked several times throughout this coronavirus about the data and the numbers, because as the president of a hospital, he sees way more numbers and looks at way more data than I do as the pastor here at Cottonwood Creek. And so what I thought we would do is we would just get with Joe and ask some questions and let you kind of give us the information that you see, kind of dig beyond the data and even beyond the news media, and you kind of give us, here's what we really should be looking at out there. And so let me just kind of fire some questions off at you, Joe. Question number one I kind of thought about is, when we think about the data, or we see the data, and we see the media reporting all of the cases, what should we be looking at, maybe nationally and then ultimately locally? And what are you seeing?
Okay, so I heard it tonight on the evening news. What I typically hear reported is the number of cases and the number of deaths. And I believe they're doing a big disservice by just reporting that data without any context.
Just the cases and the death.
And saying it's record cases and deaths. As I'd mentioned to you earlier, if I told you my son Ben got a raise and he's making more than he ever made before, do you think he should buy a new $75,000 car?
Yeah.
What would your answer be?
I still don't know the answer to that question.
Right. And I think that's what the media is reporting to us does not have enough data to have any context.
Yeah.
And I'll just say, for example, in terms of positive test rates, a rate is much more relevant than just more positive tests, because as you know, 2 months ago, 3 months ago, it was hard to get a test.
Right.
Now you can get a test very rapidly just about anywhere. My hospital, we didn't have the ability to perform tests 2 months ago, and now we do.
Right.
So what is the rate of positive versus total tests? And what is the rate of positive tests per population? Yeah. So that's one thing that's
just makes sense that the more people you test, the more positives you're going to get, right? Imagine right now if all of a sudden we started testing cholesterol at the same rate we're testing for that. Do you think all of a sudden we'd see a lot of people that had high cholesterol?
Absolutely.
The answer is yeah. So, well, as you look through some of the national data and the media, they really need to be telling us a little more, right? What are you hearing locally around us here in Collin County? What are you hearing? I know you're seeing all that data there at the hospital.
So Collin County has had a relatively low rate compared to the DFW area. The further south you go, Dallas and south, has been much, much higher incidence than Collin County. However, as the numbers have gone up nationally and in the state, Collin County is going up too. So it's all relative. Right. The percent positive and per test per administered is also going up significantly.
So there is the percentage. You are seeing the percentage positives per test go up. That's the
Yes,
other
sir.
underlying, there are more positives going up
Yes, sir.
percentage-wise.
And the number of people positive, and I also see the number of hospitalizations and number that are tested confirmed positive, and the number of ER visits confirmed positive every day.
Yeah.
And those numbers had previously been peaked in late July, early August, and then they subsided. And since the beginning of November, probably related to Halloween.
Halloween, okay.
A lot of people getting together on Halloween. Those numbers have been climbing about every day since Halloween, including in Collin County.
So your thought would be that one of the reasons we're seeing it go up locally is because of Halloween. And so now, as a hospital president and someone that sees all the data, I'm assuming it does concern you as we move towards Thanksgiving and Christmas as well, with many more gatherings.
Absolutely. I think Thanksgiving is going to create a problem. I also look at hospital occupancy, total occupancy, occupancy and COVID confirmed positives, and then available beds remaining.
Right.
And most of the hospitals around here have created surge capacities and surge plans. Right now, we're okay in DFW, but I think after Thanksgiving, we might be in trouble. And it's not just the hospital bed availability, it's the ability to staff. There are staffing shortages of nurses available.
Right.
And so that could become a problem before the bed capacity is a problem. And both might likely happen after Thanksgiving if people are not smart.
Right. And, that's why I wanted to talk to you, because I know you, after talking to you, you're not caught up into the media-driven. You're a data guy. You look at the stats. You look at where we are on hospital beds, where we are on, positivity rates and different things like that. And you're very much a realist, but you're an honest realist. And I like that. Let me ask you a question. One of the things that we hear all of the time, or at least people ask me about or talk to me about, are the tests that are out there, the actual tests that are out there, that they're like, well, can you trust the test? Do you not trust the test? And I think some of the things that feed that are things like Elon Musk just came out and he's quarantined right now and couldn't see the spaceship take off, which was his company. He had to send a representative. And one of the things that he mentioned is that he had 4 tests within the same day. 2 were positive and 2 were negative, which obviously adds to the confusion out there. Give me your thoughts on the test, and is there a test that you clearly say this is the best test out there?
Yeah. So 2 things. First of all, I didn't hear the exact story specifics.
Yeah.
When you do those tests, did they swab him once, twice, or 4 times?
Got it. Because
the swab could also be the thing. If the swab was not done as thoroughly, that could pick up less of the viral load and therefore cause a different result. But the gold standard is the PCR test. Okay.
And is that a nasal test as well?
And all of them are nasal tests.
Okay.
Yes, sir.
All right.
The antigen test is not as accurate.
Okay.
Even within those segments, certain PCR tests have a higher accuracy rate than others, and certain antigen tests are more accurate than others, because it may be kind of like the, CVS versus Walgreens. They have competing tests out there. The PCR test is the one you really want to have if you're symptomatic.
Okay. So if you have symptoms, you want to make sure that you get a PCR test.
Yes.
Okay.
But the PCR test could take a couple, 2-3 days or more to get back. And I know that if it were me, I would get the rapid antigen test and the PCR, because the rapid antigen can result back in 40 minutes or so.
So get them both.
And I would get them both if I was symptomatic, because, you may be suffering from allergies, you may have the flu, And are you going to quarantine yourself for 10 days or
Right.
let's say 4 days until the PCR results get back? And not to say that if you have enough of the signs, you may quarantine anyway, even if you get an antigen that says you're negative.
You're negative, you might.
But I would still feel like I get the antigen. If you've been exposed maybe to someone and you're wondering,
Yeah.
again, the antigen can give you at least an initial read.
An initial.
It's not as accurate as the PCR.
So you wouldn't throw them both out. You would just say, hey, what's the circumstance that is there?
Correct.
Okay. And if you have symptoms, go ahead and get the antigen, but also do the PCR so that you know. But you're also not waiting 2 or 3 days before you find out the results and how you treat it. As you think through some of the myths, talk to me. There are a lot of myths out there, right? Talk to us a little bit about some of the biggest myths about COVID-19 that you hear repeated, or when you hear that and then you know the data that you go, that is not right. So what are some that you see out there?
Well, and maybe I don't know if myth is the right word for this, but it seems to be the ongoing national argument of shutting down the country
Okay.
or not shutting down the country are our two choices.
Right.
It's
either or.
It's either or. It's bipolar.
Yeah.
And that seems to be the national debate.
Right.
And I think that neither of those are right.
Okay.
I think we should use masks
Okay.
and social distancing and good hand washing and be mindful of other impacts of shutting down the country.
Right.
There are a lot of other negative impacts.
Yeah.
So that's maybe my biggest. I feel like the media is very polarized on one side or the other.
Right.
And I don't think it's an either or.
You think it's somewhere
I think
in
it's
between.
neither.
Yeah, it's neither of those, and it's somewhere in between. And so you would lean definitely against government shutdown. But you would lean towards mask. You would lean towards
Absolutely.
mask. Well, while we're talking about masks, for those who are out there, and I've seen people even in the last couple of months or so change. People who are very anti-mask have become mask people. Some people who started off kind of pursuing mask have become non-mask people. Talk to us about what kind of mask we want to be looking for. I noticed you have
Okay.
2 of them over
So
there.
I
I
brought-
really like
yes.
one. I like one. That's the one I really like. So where did you get
Okay.
that mask?
So that I got online,
Okay.
and this is just a cloth mask.
Okay.
And if you're a data nerd like I am, and you
Yeah.
read about masks, this is like a surgical mask, and the best mask is an N95.
Okay.
But an N95 is expensive, hard to get, and it's only good for so many times.
Okay.
You can't put it in the washer.
Okay.
So, and it filters out the most particulates.
Okay.
So if you're a healthcare worker that's taking care of a positive patient,
Right.
you need the N95. If you're an ER nurse, you need the N95 and so forth. But this is a much better mask than the cloth mask. It filters out more particulates.
And so for the general public, if you're just walking around the general public, you don't really need the N95. I mean, if you have access one, use it. But and that's called an ER.
A procedure mask or a surgical mask, either one.
And those
they're
are relatively
readily
easy to
available
get.
online.
Readily available online.
Yeah,
Good.
yeah. And the cloth masks are okay. They're not as effective, but
Okay.
they
Wow.
help. The reality is, if you sneeze or cough, particulates are going to go through this mask.
They're going to go through that mask.
If you're just talking, you're probably not going to need this. But if you're sneezing and coughing, this cloth mask isn't going to do the job.
Okay. Good. One of the good things that we're hearing, finally some positive news, is that vaccines are on the way. Vaccines are on the way. And I think it was Pfizer that just recently came out and said that their initial tests were like 90% that success rate. And then I think it was Moderna that was 94.5. So I'm not sure if they were just one-upping. For those of us who we've heard vaccine all of our life, but probably for many people, we haven't seen the attention paid to the rapid development of a vaccine that we're seeing with this particular vaccine. And so we know this has happened fast. For a company to come out like Pfizer or Moderna and say we're 90% effective or 94.5% effective, what does that typically mean? How did they get to that number? Is that how many patients did they have to try it on, et cetera?
So they had to do 3 phases of clinical trials, and this is the rapid process that was instituted this year just for COVID. But they had to do 3 phases of clinical trials. That had to involve 30,000 people, and so that number is a significant number of people they're testing. And I believe Moderna is hoping to get theirs approved within the next few weeks, and they will be able to produce, they say, 20 million doses by the end of the year.
Wow.
Pfizer should be ready to hit the streets even sooner than that, and they expect to have 20 million doses available by the end of the month, and then another 20 million every month thereafter.
Yeah.
But if you do the math, is a vaccine going to get out of this situation? How many people are in this country?
Right.
About 360 million people. Just to round it off, that's 30. That's how many months? 18 months.
Yeah.
18 months to get all the way around.
So we're a long way away from getting everybody vaccinated.
And they also don't know these trials, all this development has happened so fast. Will the vaccine last a year, multiple years? They don't know that yet either. So potentially if it lasts like the flu a year, those high vulnerable people will need a second round before you and I get our first round.
So they'll need a second round perhaps before you and I even get the first one. So it's going to be a long time perhaps before it gets to the general population, the general healthy population. If you had a guess as president of a hospital, would you kind of rank, here's how I would assume they would distribute this: healthcare workers, first responders, those most needy, those in the poorest health? How do you have any idea how that might take place?
Yes, the federal government is controlling that, and they're giving that authority to the state. So Governor Abbott, if you go to the Texas Department of State Health Services, you can see their distribution plan, and they have prioritized healthcare workers and immunocompromised people, which of course, when I think of healthcare workers, I think me.
Yeah.
I'm a administrator in a hospital that does elective surgeries.
Well, you're not just an administrator; you're kind of the president over there.
So I don't think I will be seeing vaccine for a very long time. If they were to have anybody in our facility do it on the list, that would be the ER,
right? Because
they're on the front line every day, and like you said, in the big hospitals, the ICU, the ER, the people that are med surg nurses that are actually taking care of COVID patients every day or highly likely to encounter someone. Fortunately, at our facility, we test everybody before they come in to prove they're negative. So we don't
every day.
All elective surgical patients have to be tested in advance of coming in.
Patient. Okay, got it.
And of course, if an ER patient comes up and shows any symptoms, we test them with the rapid antigen test before we get them in our building.
Yeah.
So we try and keep our facilities COVID free.
Right. Oh, speaking of that, let me just follow up on that. Talking about Methodist there in McKinney, and what do you do? What can y'all do as a hospital, or what are kind of some of the procedures y'all are taking place to keep your hospital COVID free and clean? What are some of the things y'all do on a daily basis?
So that's a great question. I'm very proud to say that the number of employees, doctors, vendors that we've identified as being COVID positive over the
Yeah.
last 6 months. I don't know if this is wood table.
It's probably not, but you
it's
can knock
not.
on it.
We have not had a spread occur from one individual to another in 6 months.
Good.
Now, we've had very, very few
Yeah.
actually positive.
Yeah.
But it's really important if somebody positive were to show up and be positive before they knew it and were symptomatic,
Yeah.
that we're wearing masks, we're washing our hands, we're social distancing.
Yeah.
We're doing screens on everybody before they walk in the building every single day. And so those measures have proven to be 100% effective to date.
Okay.
And you ask me how I know. The only reason I know is because we have 13 different facilities, counting physical therapy clinics, surgery center, et cetera. And there's been one person over at this building and no one else, no patients, no
Just that
no
one.
staff,
Yeah.
just that one. And then another one 4 weeks later over at this place, and no one else got it. So
Right.
Masks and hand washing are very effective.
So you're a big fan, as a president of a hospital, of masks and lots of hand washing and social distancing.
Yes, sir.
And that's good because you know, it's one of those things that, and you probably experience this perhaps just with people you know here in the church. As the pastor, it's extremely hard to navigate where people are. Some people are like, oh, you know, I'm not going to worry about it. Other people are deathly afraid, and then a lot of people are right in the middle. And so that's why I love this. Just give us the data and let us make our own call. Let me go back a little bit to vaccines. Here's what we know, is it's probably going to be a long time before a vaccine, whether it's 90 or 94.5% effective, gets to the normal person, right? It's going to be a long time, which means there is and I'm not asking you to play a doctor here, just give me your thoughts. Have you read some data that there's a good chance that a lot of people are going to get it, right? If you get it, we're reading stuff in the news media, depending on who you're hearing, that high doses of vitamin D, high doses of zinc, you know, do seem to be beneficial and effective. Have y'all seen any data come across your desk that says, oh yeah, I would pound the vitamin D and the zinc, or do you have any thoughts on that?
I don't have thoughts on that. Two things I'll say. One, I need to correct my math. If Moderna and Pfizer are each producing 20 million a month,
yeah,
that still means it's 9 months for everybody to get one in the U.S. approximately.
Got it.
But what I do also know is the treatments that they have now for positive patients are much, much more effective than they were 4 and 5 months ago. They learned a lot, things they were doing wrong.
Right.
But there's was just an announcement for another new treatment or 2 new treatments for positive patients. And I think I am going to butcher this one, Regeneron antibody, that I can pronounce.
Yeah, that's good.
So that is to treat patients with mild COVID illness and to keep it from getting worse. And they're waiting on FDA clearance, but expect it very, very soon. And that will be just like the vaccine. It will be distributed based on the government, the Texas governor, and they'll distribute it to hospitals. Okay.
And so that would be something that they would, if someone comes in with symptoms, they could then use that and utilize it and treat them with that.
Correct.
In the hospital.
Catch it early and give you that treatment. Yes, sir. Of course, they've had remdesivir for a while, and they say, I actually checked today, and the New England Journal of Medicine said the placebo group versus the group that got remdesivir, it was more effective at reducing the severity and the duration of COVID-19. And then bamlanivimab is,
I'm glad you tried to say that instead of me.
You have to say all those hard names.
So, sounds like Greek to me.
Yeah. Bamlanivimab is, Texas should have treatments this week, but there are only 80,000 available in the U.S.
Okay.
And 300,000 available by December.
Okay.
So that's not a lot of doses.
Now, when we come talking about these doses, do you know how they divide those up? Because Texas gets a percentage. Is it based on population?
I
Is it
believe
based on
so.
positivity?
I
And then
believe,
they
well,
just
it's actually good point. It's both. It's
okay,
population and the hot zones.
okay,
So the hot areas with the highest percentage
okay.
will get the most.
And then they'll say, hey, here's X thousand coming to Texas, and then the governor gets to make a decision on here's how we are going to, most appropriately, and probably the governor and a bunch of really smart people that know,
Yes,
like
sir.
you, that know what's going on. Here's where we need to send this to, right?
Yes, sir.
Okay, cool. What well, let me just ask you a question because this is something I get asked and you hear it on the news media. Let's say that all of a sudden you were, and I don't want to spring this on you, but to take the vaccine early or not take the vaccine. If all of a sudden an opportunity showed up for you to get the vaccine in the next couple of weeks, would you take it this early, or should we be afraid of it, or would it more depend on what's your health situation?
Well, if I had the opportunity to get the vaccine, I would give it to my in-laws
Okay,
or somebody who's more needy.
got it.
But in fear of taking the vaccine
Yeah, that's
for
what
side
that's
effects,
what
I have no fear of taking it. I've read the studies. In fact, which one of the vaccines? I think it was the Pfizer one.
Yeah,
Hit a roadblock about a month ago with one bad outcome.
yeah,
And yes, there is a possibility that somebody has a side effect,
right.
and it could be very bad. But it's kind of like the measles situation. Measles was was eradicated in this
Right.
country, and the anti-vaxxer movement started, and a lot of people now have had problems with measles, and
Right.
that's a very bad thing to have.
Yeah.
So I would take it.
I like that. And you were honest. You said, hey, right now I would give it to those who are more needy than me. But you also answered the question that, that by giving it to family, you would, especially if they're needy, why would you not, right? Why would you not take it? So you're not fearful of anything related.
It's risk return. I
Yeah.
think the risk of a side effect exists, but it's probably very low.
Right.
The return benefit for somebody who's immunocompromised is very, very high.
Got it. One of the things that, and maybe you can help navigate through this, one of the things I've heard is that a number of people have gotten COVID, then they've kind of gotten over it, but then they have pneumonia, right? And that's part of the what seems to be the corresponding side effect is I'm over the COVID, but now I have the pneumonia. Is that what you're hearing a lot? Is that pretty much the number one cause of great distress for patients? It's the pneumonia that comes with COVID, or is there something else you're seeing or hearing?
I can't speak on that. I haven't read a lot about that.
Okay.
I know that they are immunocompromised,
Right.
so I could see that happening. You're talking about after the fact?
Yeah, it's like they go through COVID and then all of a sudden they're struggling with the pneumonia at the
Right.
end of the day.
Right.
So,
Right.
mm.
But it's a good segue into the flu shot.
Okay.
If you work as an employee in our company, as a vendor, as a physician, anyone who works on our facility, including housekeeping, must have a flu shot every year.
You mandate it.
It's mandated.
Yeah.
Yes.
Okay.
You know why?
Because you don't want them bringing.
It's the same as COVID. We don't want them getting patients sick, getting employees sick, getting doctors sick.
Yeah.
So we mandate the flu vaccine, and there are still a lot of people out there that never get the flu vaccine, including maybe someone in my family who may be about Jace's age.
I think you just called him out.
But those who have skipped the flu vaccine in the past, really, really need to get the flu vaccine this year, because guess what happens when you're compromised from the flu?
You're much more susceptible to COVID.
You're much more vulnerable.
So strong encouragement from you would be, doesn't matter. There may be years you skip the flu shot. This is not the year.
Absolutely. This is not the year to skip the flu shot.
Because you would not want to be coming out of a compromised immune situation from the flu and then get COVID, one on top of the other.
That's going to be a double whammy. It's going to hit your body hard.
Okay. All right.
And I'm not a doctor, by the way.
I know.
I have a degree in finance and a master's in business.
And you know the numbers, and that's why we're both in here. And by the way, I am a doctor, just not a medical doctor. Yes. So let me ask you a question. As we you talked about that. So in your opinion, masks are good and
essential.
Okay, and you wear them consistently, and even wore one in here. We both wore one in here and wear one out. So as you look forward, do you think that what do you look for? I mean, in a given day, as the president of a hospital, what do you look for when you get the data? And I'm sure you get data dumps almost daily. What do you look forward to as you look in the future when you say, okay, what's going to be, on the news in the next couple of days? What do you look for?
Well, one, I would like to see, if I could have my perfect ending to this, it would be the country got serious about masks.
Okay.
That worked very, very well in China, by the way.
Okay.
One of my doctor's father-in-law just made it back to China, and it worked very well, masking.
Okay.
2, heavy production of vaccine.
Mm-hmm.
And 3, people not gathering with extended family for Thanksgiving and Christmas and things like that. We just need to. Our family's made a decision to just keep it to the immediate family with my boys and my wife's parents.
Yeah.
It's sad, but I think if we do the masking, the hand washing, get your flu shots, postpone Thanksgiving, have Thanksgiving in February this year.
Yeah.
I think we can get this a little better under control.
Got it.
I know we can.
Yeah, and for you, and this is what I like about you is you're not carved up by the media. Someone can't look at Joe and say, well, Joe leans hard this way or hard that way. You and I are like-minded in almost every area. The thing that you do is you sit there and pour over the data, and you care about hospital beds. And so for you to sit there and say, hey, let's reconsider how we do our Thanksgiving. And that's kind of interesting. Thank you for sharing that with us. What else? So as you think going forward, vaccines, you wouldn't be afraid to take it. Some of these other treatments have been proven to be very effective, and they're moving toward FDA approval, which is absolutely fantastic. Do you? What are we technically in? Are we in the third wave, the second wave? Is this 1A, B, C, D? Because what's interesting today is this is kind of exactly what they predicted. So this is nothing new, right? They said we're going to have a surge, we're going to have a surge, we're going to have a surge. And so really there's nothing new. It's not that it's gotten worse. It's kind of just happening. The only thing that hasn't happened is the death rate. Right? The total number of deaths were so far off at the beginning, but the numbers of infections probably pretty close to what they thought, right?
Well, correct. And fortunately, they've gotten a lot better at the treatments. Yeah. And fortunately, we're getting more treatments. Yeah. And fortunately, we're close to vaccines.
Yeah. And you mentioned the treatments. Boy, you go back to March and April, we had no data, right? We had zero. Every week we get better with the data, and y'all are so good, just nationally and even locally, of give us another week's data and we're going to be better. Give us another week's data and we're going to be better. And so the further, even if there's a reason to try not to get it for a while, the more we get data, the better y'all are going to be, right?
Mm-hmm.
So. Well, you have any closing words to folks as you think about it?
No, I just think that if I could encourage everyone to get serious with the masks,
Yeah.
and get your flu shot,
There you go.
wash your hands 10, 20 times a day, and don't do a big family. In fact, I didn't mention on our family Thanksgiving, we're going to mask inside, but try and spend most of our time, especially the eating part, will be outside.
Got it. Got it.
Be smart.
Well, Joe, thanks for coming in, man.
Yes,
I
sir.
appreciate it. And thanks for talking to me over the last couple of months as I picked up the phone and said, hey, I'm hearing this. What are you seeing? And you were always so open. And we had talked about doing this, one of these podcasts in the past. And it just seems like right now, with everything going on, that I wanted our people to hear from you, because you're one of us, okay? And in large respect, you're like-minded. I mean, you're not someone that's off in the East Coast media or even the West Coast media. You're one of us. You're a Cottonwood guy, a Cottonwood Creek guy, and so for you to come in here and just kind of tell us, hey, here's the data that I see, it's both encouraging and enlightening. So thanks so much, Joe.
You're welcome. I'm honored to be here.
Well, hey, Cottonwood Creek, thanks so much for joining us again. Hopefully you've enjoyed this this podcast episode. COVID-19, we're all trying to figure it out. So my encouragement to you is stay healthy and stay safe. God bless.